Well, good afternoon, everyone. So, the resident interview tours at UCSD used to be legendary. So you would tour the hospital at Hillcrest for about an hour, and then you would pile into a van that was usually driven by the chief resident to go up to the VA hospital in La Jolla. But along the way, you would stop at the beach for a coffee, and you would watch the surfers and sea lions sunbathe. If time permitted, you would go to Mission Beach, and you would ride on one of the oldest wooden roller coasters in the country, all of us in our suits. This went on for years and years. So you can imagine myself, 20-some years ago, after having traveled from frigid Rochester, New York in January down to San Diego for this tour, I had decided that San Diego was for me. But as I was sitting nervously in the conference room beforehand with my peers, we were at a conference table, and all the faculty CVs were laid out in front of us. And there was one CV in particular that towered high above the rest. And as I leafed through the CV of Jeffrey P. Harris, I realized that I was going to have to lean in hard to the old adage that we were all told as medical students. Yes, I want to do research. And it worked. Along our careers, we can usually point to a handful of special mentors who were especially impactful in our development, and certainly Dr. Harris was for me. A true giant in the field of otolaryngology, his contributions to our field are vast and varied, encompassing groundbreaking research, exemplary patient care, and true leadership. During my residency at UCSD, I had the privilege of learning under his guidance. He had a unique talent for nurturing the next generation of otolaryngologists, imparting not only his vast knowledge of otolaryngology, but truly his passion for otology. He has been one of my strongest advocates. Even years after leaving UCSD, I still benefit from his support. And the reality is I likely wouldn't be here today if it weren't for Dr. Harris, his support in getting me my fellowship here and later on as a faculty position. Dr. Harris has had a long history here at Mass Eye. Here you can see him with his graduating residence in 1979, apparently after a few drinks, it looks like. On call. Since 2007, he has graciously funded the Resident Research Award here, providing invaluable resources and encouragement to budding researchers. Furthermore, Dr. Harris holds the distinguished title of the longest serving chair of otolaryngology in the history of the United States. But perhaps his greatest achievement, and one that certainly he can add to his CV, is that after years of practicing as a head and neck surgeon, that the passion that he instilled in me for otology lives on. Just 3 weeks ago, much to the abject horror of the residents I was working with, I performed a mastoidectomy. and I used the exact same approach that Dr. Harris taught me. And this is me performing endoscopic ear surgery for no other reason than to piss off Dan Lee. So, without further ado, ladies and gentlemen, it is with great admiration and respect that I present to you Dr. Jeffrey Harris.
Well, it's a great, great honor to be here to the institution that I owe so much to. My career, my friendship, the colleagues that we've all shared over the years. And I'd like to begin my talk and tell you about Steve Rausch, for instance. He recommended to the New England Journal that I be a discussant for the CPC. So I don't think I put as much work into anything I ever did to be prepared to do this unknown that they presented to me and discuss this down to a diagnosis which was unknown to me. And so with that as a background, I'd like to do the same thing here today with you. And hopefully you can provide some guidance to this particular case. So this is a case of a young boy who was 6 years old, had a history of left-sided chronic otorrhea. He had a perforated eardrum and failure of medical management by an ENT specialist here in Boston. past medical history was unrevealing. He was exposed to secondhand smoke, and prior management with a TNA for chronic otitis media in his left ear did not change the outcome of his care. And he was last visited to an otolaryngologist who found that he had granulation polyps in his ear and a probable cholesteatoma. Well, when you think about 1956, just to put it in perspective, the Celtics had just won a national championship, just like recently. The Red Sox had Ted Williams, who was swinging for the Fenway Park. Great Monster, is that what it's called still? Yeah. And the Green Monster. And that was the skyline of Boston, Back Bay, with the John Hancock Building. And there, of course, we've seen the Mass Eye multiple times today. So this is the case presentation of this child's audiogram. You can see a left-sided conductive hearing loss. And the child was admitted to the Mass Eye and Ear for a radical mastoidectomy for an extensive cholesteatoma. The ear was packed with cholesteatoma, filling the entire mastoid cavity. There was only remnants of the malleus left. The horizontal semicircular canal was flattened by pressure of cholesteatoma, and the facial nerve was exposed because of the same pressure. So I have to thank Jeremy, who was able to go back to the archives and with the help of our archivist here to get these records. So this child did well for a while, and several years later he began to again have recurrent left-sided otorrhea despite frequent office debridements. At age 10, he was admitted for complications of suppurative labyrinthitis with cholesteatoma. On the admitting note signed by Donald K. Lewis, the past few days, the patient has become dizzy with general malaise. The left mastoid cavity was completely filled with cholesteatoma, and the child had a positive fistula test. The patient had a temperature of 101 and was admitted with the presumptive diagnosis of cholesteatoma with circumscribed labyrinthitis, with the recommendation that a revision mastoidectomy be done. And the Donald K. Lewis was the associate director of the Winthrop Foundation, who later became this person's surgery. You'll see that the admitting resident was Bob Lofgren, and this was his admitting history and physical, and the child was put on antibiotics but broke out in a rash which delayed the surgery for the next day. He was eventually brought to the operating room after his rash cleared, and it was found that there was a fistula in the superior edge of the horizontal semicircular canal which contained granulation tissue, and at that point surgery was stopped, and Dr. Lewis consulted with Dr. Meltzer, Philip Meltzer. And so Dr. Meltzer came into the operating room with this presentation of fever, dizziness, granulation tissue, and a fistularized semicircular canal. And what do you think he recommended, a labyrinthectomy or conservative management? How many of you think that he should have recommended a labyrinthectomy? Conservative management? Okay. So there was a fistula found, as you saw, and after a consultation with Dr. Meltzer, we decided not to do the labyrinth, and the patient had a skin placed over the fistula in order to seal it, and I never saw this abbreviation before, LOMESH, which means left otitis media suppurative with cholesteatoma. So the child was admitted to the children's ward, and Dr. Lewis, several days later, took out some of the packs. The labyrinth was viable based upon bedside exam, but he still had a positive fistula test, and he was put on drops, and oral antibiotics were continued. Dr. Lewis was no slouch. He was published in the New England Journal of Medicine. and published this medical progress in 1950 and was a well thought of otologist in this area. So the patient was kept on antibiotics, and after a week-long stay still was vertiginous. The left ear maintained a maximal conductive hearing loss, but over time the otorrhea ceased, and the child was able to follow up to all daily activities, sports, except for swimming. And because of this experience, the patient thought maybe he would consider a career as a doctor. This is the child, and that child is me. So over time, I continued with my interest in medicine. I went to University of Pennsylvania School of Medicine, and there I met Dr. Herb Silverstein, and my life intersected again with the Mass Eye and Ear. And so Herb, I told him that I was here on rotation, and he said, "Oh, well, you have any interest in otolaryngology?" I said, "None. I'm going into immunopathology." And he looked at me like, "What?" And but I said, I had some ear surgery when I was a child. And he said, "Where?" And I said, "Mass Eye and Ear." He goes, "Oh, really? Come on to my office and let me take a look at your ear." So I did, and he looked at my ear and he said, "That can be revised." He said, "I can rebuild your cavity and do an ossicular reconstruction, and things will be great." And so I went home and I told my dad, who was a doctor, actually practiced in Quincy, Massachusetts, because I grew up here. And he said, "Nothing doing. You're not going to have your ear operated on again." And I was right with him there. But Herb got me interested in he was really infectious in his otolaryngology desire for anyone to be interested in it. Took me to his lab, showed me his approach to the cochlea, transotic approach to the internal auditory canal. And shortly thereafter, I met Jim Snow, who became the chairman at UPenn. And he was the youngest chairman, I think at that time, to be given that role. And again, he told me, Mass Eye and Ear is a great place. We have a great residency here at Penn, but I think if you're interested in otolaryngology, you might consider the Mass Eye and Ear. And over time, I became more and more interested in the specialty. He actually let me do a tonsillectomy as a medical student, and much to the dismay of the anesthesiologist. But nevertheless, Jim wrote me a great letter, and I fortunately was accepted here. And in 1976, I started my residency. I walked in the front door and I wanted to turn around because I had this olfactory memory of being here and being anesthetized, and I just wanted to get out of there. But fortunately, I did not. I was introduced to the many members of the full-time faculty and the important faculty that helped to guide our residents at the time. Joe is a tenacious, incredibly strong, wonderful clinician scientist. Harold was incredibly generous with residents. He would take us to lunch, and with visiting professors. He was just an amazing tower of academic medicine. Dick Fabian grabbed me one afternoon and he said, "Let's go over to the Mass General. Stephen Arian is going to give a lecture on myocutaneous flaps, and I want you to hear it with me." And so we grabbed a drink and we went over there and listened to this innovative work. As you can see, Monty, both was so inventive. We've heard this. But the thing that was really important about Monty is he was the everyman. He was everyone's friend. He taught you how to talk to people, how to connect with people, and I learned how to be a person who could to relate to patients through Monty. Over on the right, you see Jerry and Trevor, who are here, and they worked us hard at Children's. We really had tough rotation, but I laughed so much while I was at that rotation. Jerry was telling stories, and Trevor, with his very subdued humor, and his patience watching me operate was amazing. And Bill Wilson, believe it or not, if any of you don't know this, of all of the important faculty who've written papers here at the Mass Eye and Ear, he has the most highly cited paper ever, and that was on the double-blind study of sudden sensorineural hearing loss. Rounding with Monty at the Mass General, again, was a great experience if you had a lot of time, because he would stop and talk to everybody about their carving, their visits to Vermont, et cetera, et cetera. But again, he taught me how to approach patients and how to connect with them. We've been through this. Jeremy showed that. Stu Bencover, Carl Brown, Elaine Carroll, who was the first female resident to graduate, and Joe Oyer. Now, many of you don't know this, but those of you who were around at the time knew that there was an infamous saloon called Betty's Rolls Royce in Quincy Market area, and Betty was my cousin. And she got many tickets because she parked illegally in front of the restaurant. And here she is waving goodbye to me as I decided to go out to California. So I joined UCSD in 1979. Again, Jeremy, you told it right. You know, I visited when it was February here, went to the beach with my little daughter, and she said, "This is such a wonderful place, Daddy." And so I said, "Okay, I'm going to find out if I can get a job here," and fortunately I did. This was the hospital we had at the time, very small. It was a very highly academic but small program, and we did have the VA, which Jeremy told you about. I was fortunate enough to be selected very soon after in 1986, and this was the faculty that I had, Terry Davidson and myself. That was it, just two of us. The chairman had retired. Bob Cueva, who some of you may know, became the president of the American Otologic Society. He was the chief resident in this picture. And John Saad had done a Shucknick Fellowship at one point. Over the years, Joe and I have traveled places together to many meetings. If Harold Shucknick was my father in otology, Joe was my big brother. And I just love you, Joe, and I think that how you were able to help my career and given me guidance over the years was invaluable. Our department today is a lot bigger than it was back when I took over. We have 36 faculty, nothing like the Mass Eye and Ear, but it's a very academically oriented program, and very proud of our graduates. These are the facilities. We don't have to spend much time there. I just want to say that there has been a connection between the Mass Eye and Ear and UCSD. These are some of the people that were either trained here in Boston, then came to San Diego, or vice versa. You can see Ralph Metzen, who apparently keeps telling the story about how he crossed in the air, him leaving there and me going to San Diego. I did, because of Joe, develop this prize for chief residents, and I'm really proud that I could do something small to encourage residents to do academic pursuits during their residency. Joe, you deserve this Lifetime Achievement Award more than anyone I can imagine. But Joe had a lighter side, and as you can see on the left, I guess your left is riding a camel with Alan Ryan, and on the right, dancing with Bob Cueva at American Otologic Society meeting. So I want to, again, thank the Mass Eye and Ear and tell you what an honor it has been to come from here. You have saved lives. You've provided, including my own, you've provided wonderful clinical care. You've advanced our specialty through research and teaching, and I'm forever indebted to you. And I want to say one further thing. What seems to come through all of the talks is this direct lineage, and the lineage that starts back and then goes through each of you to the next person, from Herb Silverstein to me, and Gene to Herb, and me to Jeremy, and so forth. And it's just a tradition that you won't lose and should never lose. And I've tried to instill that in my residents and medical students. And I really appreciate everything that the Mass Eye and Ear has done for me. So thank you very much.